I'm Erin Camac. I'm the critical care programs faculty member, but I'm the pulmonary and critical care programs program director. I came here to the University of Kentucky about 2022 from Temple University, which is where I was an intern, a resident, a fellow, and a junior faculty member. I always had loved medical education, and I was really looking to get to sit in the big chair and do the dream job, which is why I looked for a new position here, and I'm so lucky that I did. This has been the best career move I've ever made in my life, and it's been fantastic to move here from Philadelphia, which a lot of people wouldn't think is the case. I lived in Philadelphia for 17 years, and I think a lot of folks who are from the coast may not recognize what a great little gem that Lexington is. And so in addition to getting the dream job and having all the support in the world and the opportunity to work with really fantastic people, I also am fortunate enough to have a really full and vibrant personal life here in Lexington too. One thing that makes the fellowship program stand out, only one thing, I'm only allowed to answer one thing. Okay, I think there are a few things that make our fellowship program amazing, and the most important of them is the division itself, the division of pulmonary, critical care, and sleep medicine here at UK. This division is full of and led by lovely people, folks who genuinely are good medical educators, who care about one another, who try to do good patient care and collaborate. There is not 1 ounce of elbows out in anything that goes on here. We are all working together like a family. One of the recent things about my experience with this is that I'm having a family health situation that's happening, which I expected would be a huge deal and would be a giant disruption. But all I did is come into work and tell people that that was what was going on, and I received all the help that I could possibly want instantly, which is just a sign of the kind of community that we're a part of here, which is the best part about being at UK. The second best part about being at UK is our program leadership team. I am biased because, it's a great team. We have fabulous program coordinators. We have fabulous, my fabulous colleague, Mike Powers, who's the critical care programs director, and our APDs and chief fellows. We get really good things done for the program. We feel like we're really effective and supported, and that's just a really nice little place to spend time and effort because it feels like it pays off so much. And then, of course, the third thing that I have to love around here, which of course I do, is our fellows. We are fortunate to attract fantastic fellows from across the country who are interested in a variety of careers, medical education, teaching, pulmonary hypertension, you name it, there's a fellow who's interested in doing it. And I love that spirit, that warm and excited, young person who wants to be here to learn medicine and have a good time. And, that's what we're about. Our environment for training is really high test. Chandler Hospital has over 1,000 beds and provides every high level care that is available in the country, from transplant on down to primary care. And that environment with ECMO and transplant and level 1 trauma is a perfect place to train in pulmonary and critical care because you're going to get to see literally everything. We also have a catchment that's really big. We receive patients from all over the state, from some parts of southern Ohio and some parts of Tennessee and Virginia. And that group of humans that are coming here for help is a huge population of people who have some serious aspects with access to care. So the kind of medical pathology that we see here at UK is really, really diverse. There's a ton of really advanced disease. There's a ton of really rare disease. And so it's not like you're going to come here for fellowship and miss out on getting to see the weird stuff, the pulmonary alveolar proteinosis and the Burt-Hogg-Dubé. It's here at UK, just like everything else is. It's rare and serious. I think our fellowship is known for being clinically excellent and procedurally excellent. I think those things are just the de facto expectation for folks when they're consulting us or working with our fellows. Our fellows knock out an incredible number of procedures as a part of their fellowship, so they really have confidence and steady poise as they're exiting the fellowship. I was just before this interview doing a bronchoscopy suite morning with one of our graduating fellows, and I just stood in the back of the room and watched this graduating fellow knock out every procedure that needed to be done in perfect succession, like an absolute pro. It was a beautiful thing to see, and that's the kind of satisfaction that really reaches my heart, to get to see our fellows become that proficient and fantastic. Where do we see this fellowship going? There's a lot of opportunity for us to be doing more in the community than we've been doing as a fellowship so far. Fellows outreach to things like smoking cessation and community health that are applicable to pulmonary medicine, especially in the era of global warming, could not be more important. So I'd love to see maybe a fellow who might be interested in things like social determinants of health or outcomes research getting involved in a track that has to do with community outreach would be pretty exciting. So I can see all of these diverse ways that our fellowship can serve fellows well. I would like to see the program grow in size over time. I think that we have, enlarging faculty, which increases our bandwidth to be able to train fantastic fellows and recruit really good people. And I'd love to see more research going on here at UK, especially research that's centered on the fellow rather than the faculty member. We'd love to see some fellows with T32 training grants and the kind of support that's necessary for those kinds of things to go forward. It's a new world, but medical research is always going to be a part of what we do as experts. Thank you so much for applying to our program. It's very exciting that you're watching our videos and giving us a solid look. We hope to hold your attention and to convince you that this is a place where you can see yourself thriving. Please make sure you get all of your questions answered. Ask all the hard questions. We want to hear them. We want to be able to answer them with you honestly. We'd be super excited to see you here at the University of Kentucky.